Okay, everyone, I am so happy we are back. This is How to Pass NCLEX, How to Pass NCLEX. If you are in nursing school or a nursing student, then guess what? This is the place to be. My name is Regina. All I do is help nursing students pass. Is what I've been doing for 10 years, and I'm so excited to have you joining me today. Here we go over NCLEX information. Today we'll have topics med, surg, nursing care. So I have 5 questions. That's right. I have 5 questions coming at you to review the content for the exam. Also, I like to do a little Monday motivation every week as well. So we will be talking about who runs it today. Oh, don't forget, tonight is Monday night, ReMar Nurse University, another episode. And I'm so excited because we're doing this every Monday since last week up until June 15th. And if you attended the last class, you know that it was phenomenal. So I'm promising you guys, class number 2 is just as informative, just as helpful. We will be going over pain management. So we're going to go over the different classes of pain medications. Plus, we are going to break in psychiatric medications, which can be totally confusing. So if you are a ReMar nurse, if you have the virtual trainer, if you don't have the virtual trainer, if you're still in nursing school, this is a must-see class. And again, it's tonight, ReMar Nurse University. We're doing this all month long. If you have not signed up for RNU, please, it's not too late. This is just week 2. So you can sign up at remarnurse.com/RNU. I'm so happy to see all of my people here today. All right. And you want to sign up because the downloadable PDF workbook is something that you need to have. Hey, share this video, like this video. All right. Again, if you missed it last week, we did go over the nervous system's medications, and I did a great anatomy overview during that presentation. And a lot of students were thanking me, saying that was super helpful for them. So tonight we will be going over pain management. Okay, so you're ready for pharmacology. Miami, Florida, shout out in the house. Love to see Florida in the house. So we're going over pain management tonight. Also, like I said, psychiatric medications. The class starts at 8 p.m. Eastern time. So convert that time to your home, okay? We have over 7,000 students in the virtual trainer. And you guys, listen, the numbers keep climbing. I love it. It's a growing community here. The motivations for this week before I kick it off was simply this. I got a Facebook post, and it said, "Hey, Nurse Paula, I tested Tuesday and I passed." That's it. Enough said. Came back to the ReMar family to report success. And I'm telling you guys, if you stay with me, you will pass your exam, because we are doing everything we can, including putting the best NCLEX review out there, period, on sale. Still 75% off during ReMar Nurse University. So that drops the price from $474 to an amazing $149. So I just love you guys for rocking with me. And honestly, one of my favorite things is to read on Instagram or read on Facebook where people saying, this is the really connects me to this total experience of virtual training. And it makes me feel like you guys are really, really benefiting from all the hard work that we do in the background. So thank you so much for getting in that virtual trainer, loving it, but also making progress. So we have our audience here. Hey, you made it to the live class today. Congratulations. Here is your first NCLEX question coming at you right now. All right. Number 1. Pharmacology. A client has been prescribed prednisone for long-term use. The nurse instructs the client to incorporate which dietary modification while taking prednisone. Select all that apply. All right. So when you're taking prednisone, do you, number one, is it an avoidance of foods high in potassium? 2, increased intake of calcium-rich food. 3, increased intake of complex carbohydrates. 4, increased intake of lean protein. Or number 5, limiting intake of high sodium foods. Okay, so here we are talking about prednisone. Prednisone is which type of medication? Okay, so think about what the medication does. All right. And then think about the issues dietary wise that your patient's going to have. And this is a select all that apply, guys. So that means that there could be one answer up to all of the answers that could be correct here. Okay. One or all of them. All right. So I'm going to reveal the answer to you guys, and then we're going to go over it because there's some teaching here that can be done if you're not familiar with this. Yes. So prednisone. All right. Prednisone, Cushing syndrome. All right. I like that clue. Okay. So the correct answers are, hey, just 1 and 3. Okay. 1 and I'm sorry, I'm reading this wrong. I'm sorry, just 2, 4, and 5. Oh my goodness. Here's my pregnancy brain again. Okay, sorry. 2, 4, and 5. All right. So here we go. 2, 4, and 5. Let's look at the right answers and then we'll look at the wrong answers. So the correct answer 2, when a client is taking a steroid, all right, they tend to lose calcium and vitamin D. That increases their risk of osteoporosis. So with calcium, we expect clients to get about 500 milligrams of calcium a day, right? So we need those patients to increase their calcium-rich foods, okay? Prednisone is associated with osteoporosis with long-term use, all right? So clients should increase the intake of both calcium and vitamin D. Another thing is that we know that with prednisone being a steroid, it can cause Cushing-like syndrome in your patients, right? So your patients will have like fatty tissues growing. So the patient needs to increase their intake of lean protein because this will help reduce their cholesterol. This will help reduce that weight gain that you can have when you are on a corticosteroid, okay? And then 5 is we know that steroids also increase the sodium, okay? The sodium retention in the body. So the client needs to really monitor their daily sodium intake. All right. So remember that number 1 and 3, 1 says avoidance of high potassium foods. Or remember with clients taking prednisone, their body tends to leak out potassium. So there is a loss of potassium. So we want to increase potassium-rich foods. Can you guys think of some foods that are high in potassium that would be good for the client? And then also, because we also know that prednisone increases the blood glucose levels, all right, the client has to monitor those complex carbohydrates. All right. So you really have to monitor how many carbs you're getting, because that is going to contribute to a high blood sugar level, So a lot of teaching is involved. Oh my goodness. A lot of teaching is involved when your patient is just on prednisone. Look how much dietary information you have to know. So pharmacology, very important. Shout out to Nurse Obodo, an international nurse, 15 years out of school. I used all of remarreview. I thank God I passed my RN NCLEX with 103 questions. Amazing. Thank you so much for coming and giving us your testimony. We love our international nurses here. So shout out to you on our YouTube channel. Also, I saw the comment. Somebody asked about, are we going to cover insulins for ReMar Nurse University? Yes. So insulin review will be next week. It'll be week number 3 for ReMar Nurse University. We are going to go over the anti-diabetics, so the pills, and also the different types of insulin for our diabetic patients. So check it out. You got to stick with ReMar Nurse University this month. All right. All right. How about this? Let's do another question. Okay. Question number 2 says this: a nurse works in a psychiatric unit. What client does the nurse anticipate as most likely to entertain delusions of grandeur? Delusions of grandeur. Okay. So we have here the following clients. We're looking for the client who's going to experience delusions of grandeur. Is it number 1, client with post-traumatic stress disorder? 2, a client diagnosed with dissociative disorder? 3, a bipolar 2 disorder and hypomania? Or 4, a client in the manic phase of bipolar 1 disorder? Okay. So I see the answers rolling in. You guys are pretty confident. Okay. I like it. All right. Most people can get it down to 2, but after you get down to the 2, then you have to pick the 1. So I want you guys to go with your gut right now. See if you can get this question right. The correct answer for the delusions of grandeur, remember, that is a personality. That's going to be a personality change, all right, where the person is going to be thinking more of themselves, right? Thinking their importance has significantly increased. You're going to see that in, yes, client number 4, for sure, okay? So the client with mania is most likely to exhibit an inflated belief of self, all right? That is, they will have a thought that they are more important, okay, than who they are, all right? So, if you understand the symptoms of bipolar disorder, depression, and mania, which is also another topic that we will go over tonight, then you will be so much more confident in choosing the proper medication. So show up for tonight's class, because we are going over lithium, valproic acid. We're going to go over the typical antipsychotics, the atypical. So this is where you want to be. Again, I can't stress it enough. Pharmacology is tough, except for when you study it with your ReMar family. All right, let's look at another question. And I see the questions about the virtual trainer. I will address them at the end. Okay. Question number 3 says this: the nurse administers a dose of subcutaneous heparin to a client. Which client statement most concerns the nurse? Another pharmacology question here. Number 1, I've been itchy all over. 2, I have several new bruises. 3, my temperature has been elevated. 4, my stomach has been upset. So looking at the choices here, which one is going to be the most concerning? Which one is going to be the most concerning? Okay. All right. Rolling in. Smash the share button on this video. We're studying pharmacology. Mark said, was there a lot of pharmacology in this segment? I said, no, not too much. But yeah, every question has been a pharmacology question. All right. The correct answer in regards to teaching. All right. Concerning, we're talking about subcutaneous heparin. It is number 2. I have several new bruises. We know that heparin increases the risk of bleeding. So if your patient is having a lot of bruises, then perhaps we need to check. We need to check their clotting factors. We need to check what's going on. This is more important than anything else. We don't expect itching all over from the patient. Temperature has been elevated. We are worried about the heparin to patient connection. Stomach has been upset. That's not concerning, but we do know that bruising can be a complication or a sign of a complication that the client's heparin dose is too much. Could be too much for them. All right, let's go on and let's do another question. We got more questions coming up. We got more questions. Here's another one. Okay. A nurse is caring for a client who is post-operative for a spleen repair. What is the nurse's priority? Number 1, review the client's most recent lab results. 2, perform a physical assessment on the client. 3, examine the overall trend of vital signs. 4, update the client's family regarding the client's condition. Here we go. What is the priority of this nurse in this situation? All right. What is the priority of this nurse in this situation? All right. I want to know how you guys are doing today. Is there anybody that is currently 3 out of 3? 3 out of 3 correct. All right. That would be a feat today. That would be a feat today. A lot of pharmacology. So here we're talking about the priority of your post-operative patient. Okay. Post-operative patient. So what is going to be the priority here? This question is basic client safety. You need to get this one right. You need to get this one right, guys. All right. What do you say that it is? And I'm giving people time. I'm giving people time to get on here. All right. The question is, if you got a patient, seriously, if you guys got a patient who just came back from a surgery, tell me what they need. Tell me what these patients need. All right. Review lab values. All right. I gotta belabor this out because I'm seeing a couple wrong answers. All right. Are we going to review the clients? Are we going to review the client's laboratory values? All right. You got a patient, just came back from surgery. Are we going to review the client's laboratory values? Are we going to do a physical assessment? Are we going to look at all of the vital signs? Reviewing the trends of the vital signs means you're going to look at all the vital signs. Or do we call the family and let them know how the client is doing? We all need to get on one accord on this question before I move on. And we're not. All right. People have it between 2 and 3. Some people still have 1. All right, guys. The correct answer is number 2. A 2. We have to be able to assess this client. They just came back from surgery. So we need to know, we absolutely need to know how that client is doing. Okay? We need to know how that client is doing. If you don't know how your patient is doing after surgery, then you're not a safe nurse. Okay? You're not going to be a safe nurse. And it doesn't matter. It doesn't matter what the overall trends of the vital signs are. A lot of people pick number 3. It doesn't matter what the overall trends of the vital signs are, because we need to know what's going on with that patient right now physically. All right. You got to remember they have been cut on. This is a patient who just came back from surgery. So the priority is my client bleeding? Are they bleeding out? Let's try another question here. All right. So we have a nurse is providing education on the subject of acculturation for a group of new nurse graduates. Which teaching example should be included? Okay, we're talking about acculturation here. All right. Does this mean a person holding their own culture is more valuable than another? A person learning to adapt to a new culture? A person rejecting a different culture? Or a person having a prejudice against a minority group? Okay. So here, this is a cultural competence question for NCLEX. And it says the nurse is providing education on the subject of acculturation for a group of new nursing students. What teaching example should be included? What does acculturation mean? Does it mean, number 1, a person holding their own culture is more valuable than another? 2, a person learning to adapt to a new culture? 3, a person rejecting a different culture? Or 4, a person having a prejudice against a minority group? Okay, what sayeth you guys? What do you think it is? All right, you got to know cultural competence for NCLEX. Yes, don't forget this subject. The correct answer is 2. Acculturation is when a person learns and adapts to a new culture. Yes. Okay. Did you guys get that right? Okay, did you guys get that? It is significant. It is significant to be well covered. Well covered. Yes. All right. And I'm so happy. I'm so happy. Somebody said, oh my goodness, that was on my class. Yes, we don't want to miss these questions. We don't want to miss these types of questions. All right. Got to have them. Got to know it. All right. If you didn't know what this word means, I'm giving you a chance to write it down. All right. Giving you a chance to write it down. All right. Our motivation, I want you guys to just think, okay, am I ready for NCLEX? The questions that we did today, a lot of pharmacology. Did you feel prepared for them? Did you feel prepared for that heparin, that prednisone question? You guys, we got to have all of our bases covered before we take this test. So I'm going to speak more on NCLEX and all the questions that I saw on Virtual Trainer. Well, we got to keep this program moving. So here it is. Okay, you guys are saying, okay, hold on one second. You guys are saying you can't hear. We're going to get that testimonial back up for you guys. Since there was no sound, we'll play it again at the end, correct the sound, because I really want you to hear this testimonial. It was so good. It was so good. Hey, listen, in the meantime, don't forget, tonight we will be preparing again. Tonight we will be preparing again for day 2 pharmacology review. We are going to be going over pain management and psychiatric medications, 8 p.m. Eastern time. This is ReMar Nurse University. ReMar Nurse University. Sign up for it. Woo! Sign up for remarnurse.com/RNU. Bring a friend, because you know what? It's free. You know what? It's free. All right. All right. So my motivational topic is simply this. You guys know it's Memorial Day. You got up this morning. I'm sure you have plans. People are barbecuing. People are cooking out. But you got to ask yourself, who runs it? Who runs it? And so being myself, when I woke up this morning, I literally had to be like, okay, Regina, what is your goal for today? What is your goal for today? And the question always is, when you talk about the day, either you run the day or the day runs you. Seriously, that is just what it is. Either you run the day or the day is going to run you. And so that was my motivation. Time gets away from us so quickly if you don't manage it and take massive action to be productive. I mean, you literally can, oh my goodness, you literally can lose an entire day just sitting around. You literally can lose an entire day just sitting around. So I told you guys, one of the things that I do, I put a timer on my phone. So I have this, I don't know what it's called, but it just limits the amount of social media I can consume. So it's like a 15-minute timer. So I can only be on Facebook, Instagram, whatever else I'm on for 15 minutes, and it'll shut off. All right. And so that helps me tremendously, because you literally know you can spend an hour on Instagram doing nothing. Right. And I'm just like looking at baby clothes all day. So we have to make up in our minds when we get up in the morning, who is going to control your day? Are you going to allow Mark Zuckerberg and Wendy Williams or whoever else is on TV tell you how you're going to spend your time? Or are you going to say, I have to get X, Y, and Z done? That's what it is. And so I want you guys to keep that in mind. Either you run the day or this day is going to run you. And that will happen over and over and over again until you realize, hey, it's my NCLEX test date and I don't have anything accomplished. And we never want that. Now, speaking of NCLEX test dates, you guys know, unfortunately, NCBSN is still canceling test dates. Oh my goodness. And with the new modified NCLEX, you have to, all right, you have to be ready at a moment's notice to take your exam. So I mean, it's interesting because I do think that there's a lot of benefits to the modified NCLEX, but you guys also have the stress of whether or not you're going to be able to take your test. I mean, I still get emails from people saying last week, like, hey, I'm in California, they canceled my test date. And it's just like, very frustrating, but you got to hop on it and try to get your next test date scheduled as soon as possible. And for those of you who are able to test, you got to be ready. You got to go in there ready. You're excited. Your test date wasn't canceled. And so during this time, it's like, all right, I can't waste a moment, because every day that I get closer to my test date is essential, right? And I have to be on the mindset that whether I'm going for it or I get canceled, I got to be ready. And so for you guys who are studying, it's so important that you have a system that you're following to help you eliminate the distractions. Because I know when you get on the Facebook group, and you see people saying, hey, my test date got canceled, it's a downer, and it kind of makes you feel like, should I even be studying for this? Like, are they just going to cancel me too? And so I don't want you guys to allow the experiences of some people to affect the progress that you're making. The whole intention of the virtual trainer is for you guys to get in there, make your progress, study the questions, and then get out. But because of COVID, we're finding that you have to modify your life around it. And so whatever we can do, yes. Whatever we can do to keep you guys motivated and keep you guys studying, we are doing. So we extended ReMar Nurse University to the middle of June, so that you guys can constantly have something to do, right? Something to motivate you and encourage you. So right now, again, there are 7,000 of us studying together, and it's a beautiful community. You guys got this. Yes. Don't you worry. All right. Shout out to you, Jackie. 90% finished with your virtual trainer. Okay. So just a really quick question. Somebody asked me, what is the difference between the Quick Facts book and the virtual trainer? So just quickly, and I'll be taking your questions if you have general questions that I can answer about NCLEX. So the Quick Facts book, remember, this is the book that you get if you're in nursing school. It comes as a part of the comprehensive review program from remarreview, and it's just questions and answers. Okay. So it's a great book because it's very compact. You can take it with you wherever you go. You can study it, while you're at work, or if you're, sitting there with a friend, have them ask you questions out of this. I love doing this book as well. All right. So it goes over all of these topics, lots of topics, plus it comes with its own calendar. But that's not the calendar. Hold on. I'll show you the calendar. It comes with its own study calendar. All right. And you can study this book in about 3 weeks. All right. And get it done. Lots of content. So Angie says, I love Quick Facts. All right. So yeah, study calendar. So you know what you're doing every day. One of the most challenging parts of staying consistent with NCLEX is, what am I doing today regarding my studying? So it's always nice to have a study calendar. In the back of this book is all pharmacology as well. So it is going to be cool. All right. Now, the virtual trainer, the difference between the virtual trainer is that the virtual trainer is my comprehensive program that includes lectures, homework, and practice exams. So with the Quick Facts, you don't get any lectures with this. There's nothing to explain the subjects. You literally read it. It's an independent study resource. With the virtual trainer, you get the full lectures online, and you also get your virtual trainer workbook. Okay. And this book is included so that you can take notes while you are listening to your lectures. Okay. All right. So inside of this book, there are notes and things like that. Thank you. There are notes and things like that so that you can fill in the topics, IV fluids, delegation, prioritization, infection control. You also have your homework. You have endocrine, psych, lots and lots and lots and lots and lots of topics, study calendars as well. A study calendar comes with this. And so this is the virtual trainer. Okay. It's a combination. It's a physical workbook, but it is also going to be your online program. Okay. And so with the VT, you can do it on your phone. You can do it on your laptop. You can do it on your iPad. You take it with you. It is your learning resource. All right. All right. So that is the difference. Again, we do have the VT on sale for you guys during this entire month. We have made it so simple for you to get in, get started. Yes, if you're in Africa, if you're in India, all these things, we can ship the book to you guys right now, you can get your virtual trainer. Matter of fact, if you don't have the virtual trainer, go get your virtual trainer at remarnurse.com. It will make a world of difference to your program. All right. It'll make a world of difference to your studying and in really anything that you have confusion with, right? I try to hit the most important topics. You guys know how I lecture, straight to the point. So I really focused on expanding the educational points in the virtual trainer. So if you're 90% done, then that means that you have a great handle on your peds, your maternity, your expected changes in aging, IV fluids, math. I expect you to be really proficient in those areas. And you have to be. You really have to be if you are going to pass NCLEX. Okay. So somebody says, you've been out of school for a long time. Doesn't matter to me. All right. It does not matter to me how long you've been out of school. My program is to help those. We just had an international nurse that said she was out of school. Was it 14 years? Help me remember. She was out of school for a very long time and she passed NCLEX with 103 questions. So those are the kind of results I expect from you. Nobody can tell me they were out of school for an extended length of time, and it frightens me. It doesn't really matter to me. If you have had the nursing training, you can be reviewed for competency. It's really about the content. This exam is by the book. So if you learn the stuff, if you understand the basics of anatomy, if you understand the disease processes, if you understand the medications that treat the disease processes, if you understand the surgeries that treat the disease processes, you can pass NCLEX. All right. There is no knowledge that is too far beyond your grasp. This is an exam for nurses with no clinical experience. This is an exam for new graduates. So that's you. That's you. You can pass this test. Like if English is your second, third language, doesn't matter to me. Get in the VT. Let's get your exam scheduled. You will be able to pass it. Now, we have a lot to cover, guys. Okay. We have a lot. We have a lot to do tonight. You guys will be hearing from me. You guys will be hearing from me all this month. I have a big surprise coming for you guys as well. I can't say too much about it right now, but what I want to say is that we are doing everything to give you guys what you're requesting of me. You guys know what you want me to put out. And so we're going to, try to get that to you guys during ReMar Nurse University, as well as continue to bring you great information, Monday motivations, whatever you need to pass NCLEX. So I will leave by saying what we always say here. I can, I will, I must pass NCLEX.